So, good evening, viewers and doctors. Today we are on day 5 post COVID managing the patients with none other than Padam Shri Dr. KK Agrawal. As you know that today is the fifth episode of our journey and we are on the exactly on the halfway of our journey. So far, I am very sure that you must have experienced wonderful sessions, and I guarantee you today also you will have a wonderful session. In case you have missed some of the sessions of last 4 days, I'm once again requesting all of you to go back to Med Talks by Dr. KK Agrawal or Facebook channel of Dr. KK Agrawal, or look at the email which you have got from FDC Limited and follow that link. You will be back to all the 4 episodes previous to that. So I request Dr. KK Agrawal to start the show of today. Before that, I would announce the winner of yesterday's quiz. Yesterday, Vitcofol capsule quiz winners are from Bihar, Jamui, Dr. Tanseem Ahmed and Dr. Sobha Herle from Bangalore. So with this, I would request Dr. KK Agrawal to take on the sessions.
Thank you, Anand, for continuing this session, and also congratulations to the winners. I'm going to talk about eye and COVID. Remember, I'm not an ophthalmologist, so therefore I'm going to talk about eye, what every non-ophthalmologist should know about the eye. Number one, eye is the showroom of inflammation. Remember, it's a showroom. You can see the fire from a distance. So when we talk about inflammatory conditions, whether it is ulcerative colitis, ankylosing spondylitis, rheumatoid arthritis, all inflammatory disorders sometimes can be diagnosed just by looking at the eyes, and so is COVID-19. Number one. Number two is when we talk about comorbid conditions, you say, is my patient comorbid? You just look at the eyes. If there is a retinopathy, you know the patient is uncontrolled comorbid condition, whether it is diabetic retinopathy or hypertensive retinopathy. So therefore, eyes also tells you what are my chances of deteriorating if the patient has corona. So therefore, if you say the patient has diabetic or hypertensive retinopathy, you know there is a end organ damage. So either you look at the retina or you look at the urine. Urine is the kidney biopsy. Urine is the virtual kidney biopsy. It is like it gives you everything about a kidney biopsy. So if the urine shows microalbumin, retinopathy is present. And if retinopathy is present, you know patient has microalbuminuria. If patient has microalbuminuria, it means patient has heart disease. It means patient may have erectile dysfunction. So if you say my patient has retinopathy, indirectly you know this patient may be having a coronary artery disease. Therefore, this patient may be more at prone of getting a heart attack if he or she gets a heart disease. So one thing is very common, that eye is the showroom of inflammation. Eye में आग जल्दी दिखाई देती है. Number one. Number two, when I say inflammation, it is defined as itis, I-T-I-S. So you have cholecystitis, mesenteric lymphadenitis, ileitis in COVID-19, esophagitis, gastritis. Similarly, you have itis in the eye, choroiditis, iridocyclitis, conjunctivitis. So therefore, wherever itis is present, except for laryngitis, because hoarseness of voice is not seen in this particular condition. So if I leave the larynx, everywhere there is an inflammatory possibility. So where do you look for? Easiest to look for is in the eye. So therefore, you look for a eye condition. But in eye, the cataract, the lens is never involved because that is vascular. Lens never gets inflamed. So therefore, eye is the showroom of corona as far as the underlying inflammation is concerned. Let's see is in the mom of the slides. So this is a COVID-19 and the eye for non-ophthalmologists. So before you look at the eye, you first look at whether anemia is present or not, whether jaundice is present or not. Now in COVID-19, jaundice will never be more than 5 and hence clinically may not be visible. But anemia will also always be visible. So when you look at the eyes, look at the anemia. When you look at the anemia, you know you need a iron deficiency anemia. Hemoglobin 1 to 2 gram will be lost and suddenly you remember I have to give Vitcofol. Why I'm telling Vitcofol is because you are running the quiz of Vitcofol here. You have just win a prize over the Vitcofol. That means there is iron, 100 milligram of elemental iron, there is B12, there is B6 and there is folic acid. Therefore, this I will tell you whether you are anemic or not. So therefore, don't say I means ophthalmologist is required. I can tell you that you are anemic. And if you are anemic, your iron deficiency can impair the oxygen deficiency. Next. Now, the most important thing is, this is an observation by us. I have spoken to all the people and they all agree. Though this finding is not in the literature. Peculiarly, there is a left eye conjunctivitis. I don't think so you need an ophthalmologist to diagnose left eye conjunctivitis. Every doctor can find. And if you find a left eye conjunctivitis, specifically in children and adolescents, take it for granted that patient has mild COVID-19 disease. The only manifestation may be left eye conjunctivitis. Let's see. Now, these are the patients which I have seen. I'm not an ophthalmologist. And looking at this, I have diagnosed, get a COVID test, and the COVID test came out to be positive. Classical left eye involvement. Next. Another patient, he has a swelling over the eyes, which shows a bradykinin response. This swelling specifically, I don't think so you need an ophthalmologist to diagnose this swelling. This is COVID-19 with a bradykinin response. Next. See, left eye, mild conjunctivitis, COVID positive. Next. Again, another patient showing the swelling. Next. Left eye conjunctivitis, COVID positive. Next. Left eye conjunctivitis, COVID positive. Next. Now, this is Mike Pence, the Vice President of America. When Trump was positive, this person went for a program and he said, I'm negative, but you see his left eye is showing conjunctivitis. He has a history of contact with Donald Trump. Everywhere people started talking about. So left eye conjunctivitis is corona in this time unless proved otherwise. Later on, it may become bilateral. But peculiarly, you are seeing a left eye conjunctivitis. So all those who are watching this program, if somebody says that I got up in the morning and I had some itching in my left eye, I saw there was a swelling, and most of the people will say, oh my God, I just pressed it and this might be the reason of hemorrhage. No. Left eye conjunctivitis is a marker of COVID-19. It may be the only sign. I have at least 7 patients who were positive. They only had left eye conjunctivitis. It may come and go. It may come recurrently. It can also come after you have recovered because it's a sign of underlying inflammation. After the virus is killed, the underlying inflammation may come and go. And this type of a left eye conjunctivitis may come and go. So we have learned a message, 2 lessons we have learned. Do not ignore left eye conjunctivitis. 2. Do not ignore periorbital angioneurotic type of edema. That may be a COVID-19 with a bradykinin response, a angioneurotic type of edema. Next. Now remember Dr. Li Wenliang, who was the first one who broke the outbreak of COVID-19, was an ophthalmologist, and he got infection through the eyes. So in the history of COVID-19, this doctor will be remembered, which is an ophthalmologist. So everybody started thinking that eye is the root of the infection. And later on it came back, eye is also one of the roots of the infection. Next. I'm not going to read the text. I'm only going to surface out the headings. Eye surface as a portal of entry for the novel coronavirus. The answer is yes. The virus can enter through the nose, through the mouth, or to the eyes, because the eyes contains the ACE2 receptors and transmembrane serine protease 2 receptors. So ocular surface can be the secondary site of infection or the initial portal of entry, because in the conjunctiva, limbus, and cornea, you have presence of ACE2 receptors. So left eye conjunctivitis, because conjunctiva has ACE2 receptors, virus can enter there. When you cough and sneeze, it's easy to go into the eyes than to enter the mouth or the nose. Next. So there is a link between ocular and respiratory system, and the link is a nasolacrimal duct, which connects the nose and the eyes. So from the eyes, it can come to nose. From the nose, it can go to the eyes. So remember, eyes and nose are connected. So if there is a link, therefore infection from nose can go to the eyes, from eyes can go to the nose. Next. Coronavirus has been found in tears, and that gives you the proof. Then why we can't check the tears for RT-PCR instead of doing a nasal, which is uncomfortable specimen? Because the viral load in the tears is low. Otherwise, it could have been the easiest. Take the corneal tear and check for the RT-PCR. That has not been done because the viral load there is low. What is the reason? We don't know. Next. So mechanism of eye involvement, it can be through the hematogenous blood route, it can be migration from the nose, or it can be a direct inoculation of the conjunctiva. Next. The ocular symptoms, left eye conjunctival congestion. When there is a congestion, the patient will say there is an increased conjunctival secretion. And that's the first thing with the patient will say in the morning, I got up to remove my secretions there. The patient may have pain. Whenever there is an inflammation, pain can come. When there is an inflammation, photophobia will come. And the patient may say of a dry eye. So these are the 5 commonest manifestations. But remember, these are the commonest. But if there is an inner eye involvement, the symptoms may be different. Remember, hand-eye contact is also a risk factor for conjunctival congestion in COVID-19 patients. Next. Conjunctivitis may be the first and only presenting symptom of COVID-19. When you check a family, when you ask a family and you say, so how do you ask a history of COVID-19? So how do I ask? So I ask, if suppose I want to keep a servant at my home, so I'll ask him, घर में किसी की आंखों में लाली आई थी? If she says, yes, my brother had a left eye redness, so I know the family has a COVID-19. So when you ask the family, you also ask a negative history. घर में किसी को left eye में लाल तो नहीं आया था? And if she says yes, then you know that COVID is running in that family. Remember, left eye conjunctivitis. Next. This is itis. So remember, COVID causes itis, so episcleritis, conjunctivitis, next, uveitis, next, chorioretinitis. So wherever there is iridocyclitis, next, optic neuritis. Here I am concerned because if there is a optic neuritis, then I am concerned because the patient is now going to lose his or her vision. Optic neuritis can be a direct viral invasion, or it can be a ischemic optic neuritis. So this is a condition where it's a medical emergency. Immediately contact the ophthalmologist. That is optic neuritis. Normally, there should not be involvement of vision, but if vision is involved, don't ignore. Next. Non-arteritic ischemic optic neuritis is also a possibility. So whatever I've said is, do not ignore loss of vision, which can be hypoxia, which can be hypertension, which can be inflammation, whatever, because this is an urgent condition. Remember, loss of hearing and loss of vision is a super medical emergency, require immediate high dose corticosteroid. Normally we are giving low dose corticosteroid, but in these two conditions, a sudden loss of vision or a sudden loss of hearing loss means high dose corticosteroid, immediately stat are needed. Next. Now, this is most important thing, dry eye, which can come because of conjunctivitis. But this is the most common thing we are observing because all the time we are working on the computer, working from home, working from computer, isolated, working on computer. So this dry eye may not be COVID-19. It may be a dry eye syndrome because of the computer. How can you forget that? So all of you are at home should keep a Schirmer test. So ask the patient to buy a litmus paper, which is a Schirmer stress strip, and you can check the presence or absence of dry eye, because even at a clinic on a telemedicine, you can check presence of dry eye, because if dry eye is present because of the computer, can get exaggerated by COVID-19 and requires frequent lubricating drops. Next. Now, increased use of computers in COVID-19. Remember the formula of 20-20-20. After every 20 minutes, take a 20-second break and look at a distance of 20 feet. That's for you. All of you who are watching this program right away. My program is for 20 minutes. As soon as I finish my program, take a break and look at a distance for 20 seconds, and the distance should be 20 feet away. Next. Now, increase the screen time is very, 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 very important, because when you look at the screen, your blinkage is 5-fold lower than when you are not looking at the screen. Next. And when you wear a face mask, that also can cause dryness. Now, the American Academy of Pediatrics says for children between 2 to 5 years, limit screen use up to 1 hour per day of high quality programs. This is not happening. Next. Now, these are the recommendations. You can take a screenshot and keep it with you, because the teachers may ask you that how much screen time is there. I'm not going into the detail, because if you are going to look at it, you are going to find that online classes are dangerous for the eyes. Next. Now, these are the retinal findings. That means the patient may have hemorrhage, cotton wool spot, dilated veins, tortuous vessels. Therefore, it is always better to know your retinopathy score at baseline. COVID can complicate that. Next. This is the most dangerous thing apart from optic neuritis, and that is formation of a clot in the retinal vein or the retinal artery, leading to an acute emergency response. Microclots are forming all over. They can happen in the retinal vein or the retinal artery also, which is a medical emergency. Vision loss, look for optic neuritis or a clot. Clot is you need heparin, and if there is vision loss, neuritis, you need steroid. Next. This is a retinal vein occlusion. Next. Next. This is a retinal arterial inclusion, which is a painless loss of vision. Next. Next. खत्म हो गया तो बंद करें. Now, these are the eye protection devices which are a must now when you are practicing. So that's the end of the presentation. Now I'll come back to the revision. And the revision is that, the revision is that avascular areas in the eye are not involved. Eye is the showroom of inflammation in the body. When you are looking for itis, conjunctivitis is the first one. When you're looking for conjunctivitis, focus on the left eye. Left eye conjunctivitis is very common in children, maybe the first manifestation, maybe the only manifestation. Sometimes it may come and go. During menstruation, a lady may say that my left eye conjunctivitis came and I started my periods and my conjunctivitis disappeared. That is an observation. Conjunctivitis sometimes can come and go and then again come back. It can be recurrent. It can also appear after the 9 days when the virus is gone as a trigger of the inflammatory response. So conjunctivitis tells you that there is an inflammation in the body. Check for other parameters of inflammation, that is rapidly rising CRP and rapidly falling lymphocytic count. So simultaneously, if you see a patient has rapidly falling lymphocyte count with a simultaneously rapidly rising CRP, it's an indication for starting a steroid. Never, 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 never miss a loss of vision, even if it is transient. Even if it is transient, there may be a microthrombi and patient has a vision loss, painless for half an hour, recovers. Never ignore, because the second one may be a permanent vision loss. The patient requires urgent oral anticoagulation or injectable enoxaparin at that particular moment. Irrespective of the age, do not ignore the eye, not only in corona, in any inflammatory disease, because eye is the showroom of corona. That's all for today as far as eye is concerned. Before I take some question answers, let me first take the quiz of the day, the Whitco Fall quiz of the day. The Whitco Fall quiz of the day is: hepcidin is synthesized in liver, adipocyte, retinal cells, all of the above. Send your question now. We will pick up 2 answers who will be awarded tomorrow. Remember, Whitco Fall, Whitco Fall. Vitamin, CO means B12, Fall means folic acid. So Whitco Fall question of the day: hepcidin is synthesized in liver, adipocyte, retinal cells, all of the above. Start sending your questions now. I've started seeing people are sending. Somebody is writing B, somebody is writing D, somebody is writing A, somebody is writing C. Find out the answer and we will select 2 people to announce the prize tomorrow. Let's have back Anang here with us. Yes, Anang.
So
I have
once
seen
again,
all the questions. all the questions have been covered. I have just checked all the questions which people are asking have been covered. Remember, this presentation was for everybody, not for the top ophthalmologists because they are an expert. But I thought that every doctor should know this much post-COVID eye features.
So, sir, I take the opportunity of, first of all, thanking you because today you have said very clearly that I said it all. I mean, it can be interpreted in many ways. I said it all. Dr. KK Agarwal said it all about the eyes. So thank you, Dr. KK Agarwal and the viewers. Again, I'm requesting you to be online tomorrow as 8:30 p.m. because we have another 5 days, and in 5 days we are going to take another different vital organs where COVID impacts. Thank you very much.
So thank you everybody. Look at your eyes. बहुत प्यारी होती है आंखों में. कहते हैं जिन लोगों को people who are inflammatory people who are prone to get inflammation, वो आंखों में बात करते हैं. And when you are looking at somebody's eye, आंखों में बात कर रहे हो और अगर आपको लेफ्ट आई में लाली दिखाई दे तो बोलो भाई तेरे को कोरोना तो नहीं हो गया है. We'll be back tomorrow with one more subject and tomorrow we will talk very important subject. कल का सब्जेक्ट नहीं भूलिएगा because we will also be talking about GI, gastrointestinal manifestations, which can be the only manifestation of Corona-19. We will differentiate tomorrow between small and large intestinal diarrhea. We will not be touching liver because that we will be having a separate talk on that. Thank you very much. Stay tuned. Come back tomorrow.